The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another edition of The Genuine Article. And today I'm talking to Dr. Antonio Baez-Janis. And Tony, as I'll call him, is the professor of medicine at the University of Barcelona, the head of the heart failure transplant program at that institution, and he's the senior author on a fascinating paper about to be published in JACC that deals with the ability to predict sudden cardiac death in heart failure patients. So Tony used a biomarker to identify patients at risk for sudden cardiac death, soluble sST2. Can you tell us a little bit about this biomarker?
Sure. This is a biomarker that was identified 7 years ago in cell culture, and actually is a biomarker that participates in inflammatory processes and remodeling and has some fibrosis effect on the heart.
And there's some data out there that sST2 is a valuable marker of heart failure, isn't there?
There's out there data that suggests that it's a very good marker to predict long-term events in patients with acute heart failure and also in acute coronary syndromes.
Now, you were interested in looking at predicting sudden cardiac death, and this is fascinating because it has implications for the application of ICDs in patients with heart failure. So how did you go about studying that?
So this is a post-hoc nested case-control study from a music study that we already performed to identify predictors of sudden cardiac death. And in addition to the clinical, to the echo variables, to the biochemical conventional variables, we added sST2 in our multivariable analysis, and we identified that sST2 was additive and was independent predictor of sudden cardiac death to NT-proBNP, to acute myocardial infarction, EGFR, and left atrial dilatation.
Yeah, now as I recall, you sequestered 36 sudden cardiac death patients and compared them to about 63 controls to show these differences between sST2 in sudden cardiac death and others. Now, how about in terms of risk as an individual biomarker or added to other biomarkers?
What we found is that in the group of patients with sudden cardiac death, NT-proBNP was higher than in the controls, and sST2 was also higher with a 0.23 nanograms per milliliter in cases and 0.12 nanograms per milliliter in controls. So when added to NT-proBNP, the logistic analysis was stronger, and the combination of the two markers gave us increased power. Therefore, when the two biomarkers are below the cut points, only 4% of patients experience sudden cardiac death, and when the two biomarkers are above the cut points, 71% of patients experience sudden cardiac death.
Well, that's really very powerful. Using the two biomarkers, NT-pro and sST2, you can identify a cohort where the risk of sudden death is extremely low and another one where it's extremely high. Now, one of the major issues we confront, of course, is the application of defibrillators in patients with LV dysfunction. How do you see your data fitting into that equation?
See, in this study, we excluded patients who already were wearing a defibrillator. So secondary prevention is not the case here. Patients with very low risk is not the case here. We are aiming to patients with intermediate risk, and these are the most difficult patients to stratify. I would say that if both biomarkers were low, we have very, very low chances of our patient to suffer sudden cardiac death. This study needs to be validated by other studies, but eventually, if this is confirmed, this patient probably would not need a defibrillator.
So you think that the possibility exists that we might be able to identify those heart failure patients who could get by without a defibrillator by applying the biomarkers?
That's exactly it. And I think we should be able to measure these biomarkers or to monitor our patient with these two biomarkers. And as long as they remain low, probably we can continue following our patient medically. And eventually, when they start raising, a defibrillator could be a good option, or CRT.
Excellent. This is really provocative data, hypothesis generating, and we'll look for you and your colleagues to follow this up with bigger studies in the future. For the Genuine Article, I'm Tony DeMaria.